Good morning, everybody. It is Dr. Michael Patmos, and today is May 28th, 2026. Well, I saw an article this morning that got me thinking, and it's about something that I have been thinking about for a long, long time. For those of you who don't know who I am, I'm an internal medicine physician. I have added qualifications in infection control. I also am an executive. I have a master's degree in management from the University of Southern California, and I've spent the last nearly 50 years as a practicing physician, and 25 years of that also in various roles as a physician executive. So during the course of my career, I have requested procedures and also been on the other side of evaluating, approving, and denying procedures. So I have seen the prior authorization process from both sides, and I understand it very well because I have sat on both sides of the process and looked at both sides of the equation. Well, this morning I came upon an article that really I thought was great, and it prompted me. I should write about this and speak about this because I've been thinking about it literally for decades. But I saw an article this morning about how the prior authorization process for vaccination varies so much from one health plan to the next that it creates confusion for doctors and adds a significant administrative burden. And most concerning, it could actually be interfering with the effort to vaccinate people. Now, we have enough issues with getting people vaccinated with all the anti vaxxers and the false information, misinformation, and disinformation. The last thing we need now is to have a regulatory hurdle that adds to that difficulty getting people vaccinated. And so that got me thinking that it was actually good timing to do this little piece here. So not only is there inconsistency from one health plan to another with respect to the prior authorization requirements for vaccination, it can even vary within the same health plan based upon benefit design. Now, if that isn't confusing enough, consider this. There are a whole host of procedures that require prior authorization that I think you would agree, you would have to wonder why on earth are we requiring such prior authorization for such things that just don't seem necessary to require it. I have kept a log. This has occurred to me over decades, and I've kept a log of some of the really silly things that I've had to either request a prior authorization for or been required to evaluate a prior authorization for that just seemed odd and kind of unnecessary. Here's the list of just a few of the things that I have seen. And by the way, it's all down in the text below. But I've actually seen prior authorization. Some health plans actually require a prior authorization for vasectomy. How about colonoscopy for fecal occult blood positive stool? How about chemotherapy for acute leukemia or other metastatic cancers? How about imaging for a breast mass? Arthroscopy for a traumatic shoulder injury with MRI, with an abnormal MRI. Prior prothrombin time and INR, PT-INR for a patient on warfarin. Really? You're going to require a prior authorization for that? Who's going to deny that? I'm kind of curious. Um, Flu vaccination, other vaccinations, cardioversion for atrial fibrillation, chemotherapy for a child with Ewing sarcoma, pacemaker and automatic implantable cardiac defibrillator checkup, intravenous fluid for hypotension, syncope, collapse, hypercalcemia, a postpartum follow up for a patient who just had a baby with an OB, with her OB. These are just a few. I mean, I think you get the point. If you're a doctor, it's pretty obvious. It's kind of silly to make checking a PT-INR for a patient on warfarin require prior authorization. That would be that would be malpractice not to. So I can't imagine anybody denying these prior authorization requests. So if you wouldn't deny them, why are they even required anyway? So all of this is really a giant opportunity for the health insurance industry to make things better for all of us, including themselves. I would recommend, and I'm calling for health plans to do a top to bottom review of their prior authorization um, processes and ask the question, look, why are we asking for prior authorization for immunization or imaging for breast mass? And what are the statistics? Are these ever denied? If you're a health plan and you're requiring prior authorization for a procedure that's never denied, that no one is going to deny, like PTINR for a patient on warfarin, then why are you requiring it? All you're doing is adding administrative burden, hassle, and increasing the hassle factor for everybody. Making it you're also making it very annoying for patients and for doctors to have to deal with this. I think if health plans just did a top to bottom review of all the procedures that they currently require prior authorization for, eliminate those that are really obviously unnecessary or that are never denied, and just take them off the list. You'll save a lot of time and you'll save a lot of administrative expense for yourselves and for doctors' offices. And very importantly, health plans, I believe health plans, do overall do a good service. Everybody needs health coverage. People all want health insurance coverage. Health plans are important. I appreciate my health plan. I'm a Kaiser Permanente enrollee. I love Kaiser, and I'm so grateful to them for the high quality of care and the ease of access. So I'm not dissing on health plans here. And I'm also not saying that prior authorization doesn't serve some purpose. It certainly does. I've done this work, and I know that doctors sometimes ask for things that are unnecessary and inappropriate and should be denied. But that's not true for all things. And I think the health insurance industry could make things a lot better for all of us, consumers, patients, providers, and for themselves by taking a good look at the prior authorization process, rethinking it, reforming it, streamlining, and improving it to make it more efficient, less of a hassle, less of a burden, and certainly not having prior authorization be a unnecessary barrier to care, for example, when it comes to vaccination. So that's my thoughts for today. I'd be interested in hearing your thoughts. And if you're a health plan executive, think about this. You could really improve your perception with the public by doing this, and I'd make a big splash about it. Say, hey, we're at our health plan, we're making your life easier and better. We're going to eliminate unnecessary prior authorization. Boy, that would be so well received by the public, by the press, media, regulators, politicians. No one would be angry with health plans if they took up this initiative. Have a great day.